right? How provider will write? Hepatitis. So hepatitis, what is hepato? Hepato means liver. What it is? Hepato means liver, and itis means inflammation. Itis means inflammation. So this is the reason why medical coding is, sorry, anatomy and medical terminology is important in this medical coding. Important in this medical coding. So whatever the definition that we saw here, so you got an idea why this anatomy and medical terminology is important in this medical coding. Because see, medical terminology, this is actually a science. It is also science, and what it is doing, it is dealing with the proper use of medical terms. But it is doing proper use of medical terms, and also like we using this medical language, by using this medical language, so we are accurately describing the human body and associated components and processes. So what does it mean? What is the meaning of this sentence? It was describing the human body and associated components and processes. So it is nothing but, so to pronounce human body, to pronounce human body components and okay, so to pronounce human body and its associated components and processes, we will be using this medical language, right? So everybody clear with this definition of medical terminology? What is medical terminology? If somebody will ask you tomorrow, right? So what you are learning from the medical coding, right? Sir, medical coding, right? So medical coding, foundation for the medical coding is the medical terminology. So without knowing the medical terminology, will not do accurate coding. We can't be doing accurate coding. So that is the reason why. So medical terminology is very important in medical coding. Right? So this is the proper and specific definition for the medical coding. Specific definition for the medical coding, right? And the next thing we can see here, simplified medical language. So here I have divided hepatitis into two words. Can you guys see this? Hepatitis, I have divided this hepatitis into two words. So hepato is nothing but liver. So this will become the main word. This will become the main word. So why I am making it as a main word? Because this is indicating the body part. This is indicating the body part or the organ. And itis, it is nothing but whatever the dysfunction that the patient is having, whatever the dysfunction that the patient is having. So this is indicating the dysfunction of an anatomy of the organ or a particular system. Right? So this is called as simplified medical language. Simplified medical language. So basically for the dividation or for the separation, right? So for example, if we have one word is available, for example, we have CPR. How many of you know what is CPR? How many of you know what is CPR? Okay, leave that CPR. How many of you know cysto? How many of you know cysto? Anybody have any idea what is cysto? What is cysto? Yes. I need responses. What is cysto? What is bladder? What is bladder? Yes, no. People are responding or not. What is cysto? Cysto is nothing but bladder. Cysto is nothing but bladder. So cystitis, what it is? Cystitis. So cystitis is nothing but bladder inflammation. Bladder inflammation. So to identify the medical terms, so we do have, so totally in a medical term we have to break down the word for the three words. How many? Three words, as three words. So how we are dividing these three words? One is main word, which indicates the body part, right? And the next one is suffix, right? So suffix will indicate the abnormality, and prefix and whatever the system that is involving, and this particular body organ is belongs to which system, right? So totally if we check this thing, right? So medical terminology, right? So we can see here, so building blocks. What it is? Building blocks. So we can see here, so simplified medical language. So but the building blocks for the most medical terms is the root word. What it is? Word root or the root word, which is indicating the primary body of the word. Primary body of the word. And at times a medical term can be made up of compound words. So compound words may consist of two words, such as the case of collarbone. What it is? Collarbone. So this is the example for the two root words are there. So for this word there are two words. We can see here, this is the collarbone, right? So this collarbone, so actually it is related to musculoskeletal system. So there is a bone available around our neck, right? So which is called as collarbone, which is called as collarbone. So in this collarbone, so we have two terms are there. These two words are the main words only. These two words are the main words or the root words, right? So to identify this type of words, right? So we have to learn the medical terminology. We have to learn the medical terminology. So that is what we can see here. To facilitate the pronunciation of a words, so combining a vowel placed between word roots, a significant number of medical terms use the vowels. So however, it's good to note that O is not the vowel sound. O is not the vowel only. It is a critical that you have a strong knowledge about the medical terminology, right? So what does it mean? It means that so whenever we are pronouncing a word by like whatever the word that is containing two root words, so we can add a vowel sound between that. We can use vowel sound between two words, so that will become a word, that will become a complete word, right? So that means we have an opportunity to use vowel sounds. So vowel sounds are nothing but A, E, I, O, U. A, E, I, O, U. So these are the vowel sounds. So how many of you agree with this? Vowel sounds. So how many of you agree with this? Vowel sounds. A, E, I, O, U. A, E, I, O, U. So are these vowels are correct? Yes, no? I need your attention whether you guys are listening or not. Yes, no, yes. Yeah, these are the vowels, right? So I need responses. 19 members responses I needed in the chat box. Whenever I know I am seeking for the attention from you guys have to respond. So that is the minimum responsibility of you guys, right? So like people are joining the session and they are like sitting idle. No, that will not work here, right? So whatever the sessions that I am teaching here, I am like completely putting my 100% efforts to teach you guys, right? So that is one thing you guys keep in mind, right? So whenever you are attending the session, please, I'm requesting you all, please pay complete attention, right? So whenever you're listening to the session, please pay complete attention, and whenever I am seeking for your responses, please try to respond in the chat box, so that is an encouragement for me, so that I can share more information for you guys, right? So that is not an advantage for me, right? So that thing is only advantage for you guys only, right? So like correct me if I am wrong, right? So these are the example words we can see here. Root word, combining vowel, combining form, meaning, right? So we can see here, for example, we have three letters are there, which is called as ACR, and we have added one vowel sound to it, so it become acro. So acro is nothing but, the medical term acro is nothing but extremity. What it is? Extremity. So extremity, right? So this word, how we are using this word in medical language, okay, so like we can see here, so what it is? Extremity. So this extremity we can see here, acrocyanosis. What it is? Acrocyanosis. So this is the word we are using in the medical record, we are using in the medical coding. So if you came across this word called acrocyanosis, so you guys don't have to confuse, arey what is this condition, ये तो बहुत हार्ड है भाई, ये कैसे आइडेंटिफाई करूं मैं? Yes, you can identify this word, right? So how we can identify this word? So we can acro. What it is? Acro is nothing but, what it is? Acro we can see here, this is the acro. So acro we have slash, and then we can put one vowel sound, and cyanosis. What it is? Cyanosis. Can you guys able to view my words? Cyanosis, right? So we can see here, okay, so this is a condition related to the extremity. This is the condition related to the extremity. So this is how we have to identify the conditions. So everybody clear with this, how to add the vowel sound to a medical term, right? So any body part, or to combine any dysfunction to the main body part. Everybody got an idea what it is? Yes, no? So how we are adding this vowel sound and all, please, everybody please try to respond in the chat box, so that we will move to the another section. Yes, no? Yes, 7. Okay, so like I got only 2 responses, 3. You guys are not getting, or you guys are wantedly not responding to my attention? Yes. Okay, yes. Yeah, so that is the one thing I would like to tell you guys. Yeah, so I have mentioned there are three words are there. How many? Three words. So each word we have to break it down as on three words. So these three words we can see here. The first one is root word, and the second one is prefix, and the third one is suffix, right? So root word mainly indicating the body part, prefix the word which we are going to add before the main word or the root word, right? And the suffix is nothing but we are adding this suffix at the end of the root word, right? So whatever the dysfunction that you can see, itis, cyanosis, ology, right? And whatever the things that you can see at the end of a root word, right? So that is considered as a suffix, right? At the starting of the word, hyper, hypo, tachy, brady, right? So all these things, right? So considered as a prefixes. So what exactly the root word indicates? So we can see here the main part or stem of a word is called as a root word. The main part or stem of a word is called a root word, and a root word conveys the essential meaning of the word. The root word conveys the essential meaning of the word and frequently indicates body part, and also it is frequently indicating the body part. And with the combining form, the root word and combining vowels such as a, e, I, o, u may be combined with another root word, a prefix or a suffix to describe a particular structure or a condition, right? So what does it mean? It means that it meant to say that so whenever we are putting any vowel sound after the root word or to the main word, so that will become a particular structure for a condition. So we can see here this is an example word, cystitis. Cysto means bladder, itis means inflammation. And also there is a procedure called CPR. What it is? CPR. So if we break down the CPR word, so cardio means heart, pulmonary means what? Pulmonary means lungs, and then we have resuscitation. It is nothing but a procedure. So we can see here, so cysto is nothing but bladder. So CPR we can see here pulmonary, cardiopulmonary resuscitation, right? And we can see here cardio is the root word meaning heart, right? And we can see here pulmonary, it is a root word meaning lungs, right? And by performing CPR, we can introduce air into the lungs and circulate blood by compressing the heart, resuscitate the patient. So this is the exact meaning. Of this word CPR. What it is? CPR, right? So now you guys can able to identify the medical terms. Now you guys can able to break down the words with this example. Yes, no. Is it easy or hard? Yes, no. Is it easy or hard? Yes. Hello, can you guys respond in the chat box? Yes, easy, right? So it is very easy, right? And the next we can see here prefix. What it is? Prefix. So prefix is nothing but we can see here the prefix can be added in front of the term, to modify the root word by giving additional information about the location of an organ and the number of parts involving into that condition or time involved, as well as a medical and scientific terminology, right? So this is one point we have to remember. So what is prefix here? Somebody will ask you what is prefix. So prefix can be added in front of the main term to modify the word root by giving an additional information about the location of an organ and the number of parts and also the time involved, as well as in a medical and scientific terminology, right? So for example, we have a word available, hyperventilation. What it is? Hyperventilation. So hyperventilation, we know what is ventilation. So what we have added, so in this word, so ventilation is the main word and hyper is a prefix. So that it will become a hyperventilation. So hyperventilation is nothing but excessive ventilation. What it is? Excessive ventilation, right? So example for the prefix is hyperventilation. This is just an example. So whenever you guys are getting into this medical coding or switching your jobs into this medical coding after your graduation, so you guys have to clearly identify the words, what is prefix, what is suffix, what is main word, right? So you guys have to clear idea regarding this medical terms to identify the conditions, so everybody getting, right? So what is, yeah, so everybody getting, yeah, so this is the example for the prefix, right? And the next one is suffix. So the suffix is nothing but, as I have mentioned that, so the suffixes are attached to the end of a word, root, and adds meaning to change the original meaning, such as conditions, disease process, or a procedure. So this is what we have to do. An example also we have given here. So what is that example we can see here? So commonly example suffixes itis, inflammation, right? So with this, this suffix is paired with the prefixes, which means arthro. So for example, arthritis, what it is? Arthritis. So arthritis is nothing but inflammation of the joints, right? So this is regarding our